Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department doing a COVID-19 update for October 21st. It's been a few weeks, so let's jump into it. Our phone number is 508-495-7485. Our email is health@falmouthma.gov. So 5,637 PCR positive tests since the beginning of March of 2020. There's been 46 over for this past week. The last 4 weeks have been averaging about 50. So relatively consistent from the entire summer, 30, 40, 50, 60, 30, 40, somewhere in there. And the last 4 weeks, about the same, about 50, maybe slightly higher. Previous last 4 weeks, the average 9 probables. Those are not home kits. If you remember the presentations I've given back, and since the home kits are going to be what most people are using for tests, and they are not going to show up in here because they are not contact traced. You don't go through the Maven online. We have a dashboard that we do all our contact tracing from, so that's not going to show up. Home kits are not reported. So there is a fair amount of COVID out there. You probably know through friends, family, or yourselves that it's been hitting people all summer long. How many a week? It's hard to tell. There's definitely more than 50 per week. The multiplier could be 5, could be 4, it could be 2, probably closer, more than 2 times what we actually get for a case count with PCR. Our incidence rate, which is the number of daily cases Falmouth would have if it had a population per 100,000, is 22.8. For the 2 weeks between 10-2 and 10-15, and a percent positivity is 11.6. The positivities have been high, and I think part of it is because during the pandemic, when everybody used PCR, they also went and got a test. You probably have on the call, if you're listening to this, due to being a contact. I don't think people are running down and getting a PCR test because they were at a family gathering and Aunt Millie tested positive the day later or 2 days later. So I think people that are actually sick are the ones that are getting tests. So if they're getting, and also this number, a lot of hospitals are also testing before you have surgeries or procedures, and you might be banging out a test of a positive that you had several months ago, because PCR does tend to show positive for an extended period of time after. So, it's been high. I think the state's 7 point something for positivity. So the positivity has been high since sort of home kits. And I think maybe it's just a certain audience is what's getting a PCR, and it happens to be those that tend to be positive through symptoms and so forth. But, that's just one reason. Barnstable County is in the medium category. The entire state's medium yellow. 157 cases per 100,000. 13.1 is the new admissions per 100,000 population. 10 is the line, and we used to hover between 9 and 10, 9 and 11. So that's up a little bit to 13. Staffed inpatient beds used with a confirmed COVID-19 is 4.2. That's higher than it's been. Usually that number's been down around 2-ish. So there are more hospitalizations. You'll see it in this chart I'm going to show you next. The far right is the more recent. You can see an uptick in hospitalizations. And one reason would be it's not, again, let's go back to January of 2022. You can see the Omicron. Omicron is less severe, generally speaking, than Delta, plus we had our vaccines. The first bubble would be the Delta wave. That's where we had a high, the death, the severity, the lower respiratory. Omicron, just by its sheer number of cases, way more cases than in 21, did cause hospitalizations, and you can see that spike. So we're nowhere near that, but you do see an uptick over the last month or so in hospitalizations, and being reflected in these numbers here, the 4.2 and 13.1 being higher than the summertime, and since I've been putting this in, probably since the spring. And I'll talk a little bit about the second reason why in a minute, I think, is what's going on. So case-wise, last time I put this in, I think it was 9,000, 7,000, 8,000. So they're in that thousands per week of PCR positives. The state's positivity for that time frame, 7.31. So the trends here, you see cases aren't really all that relevant because most people are getting home tested. Again, these are PCRs. Testing pretty flat on testing. But hospitalizations, you see a bit of an uptick. Deaths, you don't. Again, we have high vaccination rates, and these variants aren't quite to the same extent of previous ones. And so that sort of number is pretty stagnant since the spring, March of 2022. That number's been on the low, sort of meandering there. But you do see a little bit of an uptick in hospitalizations, and that's probably your best indicator if there's a lot of COVID around or not. MWRA numbers, again, left is the south, right is the north, and MWRA is the Boston. It captures a lot of people. It's their sewer system and how much viral DNA that they're showing up in the wastewater. It was pretty flat all summer. Then you start seeing it coming up in September and sort of leveling off, maybe dropping a little, leveling off from the highest numbers, which was maybe a week or two ago. Still nowhere off the chart. If you look at the far left, that's off the chart. That's coming off the Omicron surge that we had in January of this year. So again, relative to that, we're still in good shape, but you do see an uptick relative to the summer, which I would say isn't surprising as we go indoors, right? So as we go indoors, we tend to have this come up, cold flu season, so forth. Again, looking at incidence rate, Falmouth's on the high middle here, 22.8, a couple towns a little higher, a couple towns right around the same, a couple towns a little lower, some towns a little lower than that. The Outer Cape generally, there was a little bit less opportunity for PCR. You see more of the rapid there. So those numbers have always been relatively lower on the Outer Cape because they're not doing PCR as much. 2020, they didn't have a lot of sites that did PCR. They were doing the rapid antigen. It still just basically means we're picking up a fair amount of PCR. That means we have a fair amount of COVID out there. Same thing here. We're on the higher side for higher middle, sort of same for the county of that number. So PCRs are what they are. An indicator that there's COVID around. I mean, these numbers aren't low, so if these numbers are high, then there's a lot of COVID around. As far as vaccines, this is getting to my second point. You still get the vaccines through VaxFinder. Homebound can still call the health department. We do get calls maybe once or twice a week looking for a booster or looking for a vaccine of some sort, whether it's the first one or a booster. You'd call the health department if you're truly homebound, get your information. We'll have the VNA call and schedule with you at your house. There was pharmacies, community health centers, so VaxFinder is where you'd go. There are appointments available because the bivalent's been out recently and there's been a demand for the bivalent. I don't think you may not get an appointment, in Falmouth today, but I looked and it looks like there's a few days away. You might have to wait a week or so, but there are appointments available. So if you're thinking about it, especially say I want to have it before I go for Thanksgiving, then you really should think about booking it in the next week or two, because that has to have a chance. The bivalent has to come back to flood it with bivalent. Especially the Moderna, I think is a little bit harder to get right now. But there are appointments available. But if you're thinking about it and saying, well, I'm going to wait, you should do it now. Again, they recommend 90 days if you got infected to wait 90 days until you get a booster. But if you haven't been affected and it's been at least 2 months since your booster and you haven't had any COVID that time frame, then you look at getting an appointment. That's what you want to do. Children less than 3 should go through the pediatrician's office. There's a few there, but you can search on VaxFinder by that age group. As far as testing, again, most people are using home kits. Falmouth Hospital still doing theirs. Convenient MD and the pharmacy still do some testing, so that can still happen, but home kits are what most people are using. Update on boosters. CDC recommends that people ages 5 and older receive 1 bivalent booster if it's been at least 2 months since their last vaccine, whether it was either their first primary series, like you get vaccinated for the first time, or your last booster was an original monovalent. So it's been 2 months. They recommend if you're over 5 to get your booster. Again, be patient. The bivalent's been out for about a month now. So people have gotten more than 1 original monovalent booster. Also recommend to get an updated bivalent booster. Okay. So bivalent means it's got both the original and then the BA4 and BA5 Omicron. So it's bivalent means 2. So that's what the bivalent is. And so that's where your next booster is going to be. And so if that's something you're interested in, then you should do it. Looking at vaccine rates, and this brings me to my second point about why the hospitalizations might be going up, is that if you look at boosters given, the numbers aren't perfect. And I think part of it is this is the state's numbers. And you see that we gained 235 and 29,681 first doses. I think some of those were boosters. Myself, just because I think that number's The number's probably a little high, and some of those, again, if you come in for the first time, you don't remember if you've been or you don't have a card, sometimes those might fall into the booster. So I think the boosters given might be a bit higher than 53%. And the total number of people that have gotten vaccinated the first time might be slightly lower because you're looking at 91%. We're probably, maybe let's say 89 might be a more number, and then a few more people have actually been boosted. Again, it's about filling, the people giving boosters are more concerned about giving you the right booster and doing it from a nursing standpoint and an administration standpoint. Sometimes the paperwork might get a little wacky, but anyway, as that said, we gave out 865 first, second, or first booster doses during that time frame. So the three columns, the first booster or original booster over to first doses, over the 3.5-4 week span, it was 865 doses. But looking for the second booster, only 23% of us have gotten that booster. And I think part of it is those that have only been living with their primary series, the first, second dose, and never have gotten boosted, those vaccines have waned. And if you're one of those high-risk people, but based on your age or your physical status, your immune system, and so forth, and all you've relied on is shots that you've gotten in March or April of 2021, those have waned. And with the current vaccine rates and the boosting rates, rather, I think that might be one of the reasons why the hospitalizations have gone up. First off, there's plenty of COVID around. Second of all, some of these non-boosted people are, they may have had a reaction to their primary series and said, I'll never get a booster. Whatever the reason, never gotten back to it, got sick of dealing with COVID. Whatever the reason, 23%, 7,000 people have gotten a second booster. And about half have gotten, according to these numbers, a first booster. So those numbers tell me that there's a lot of people out there that have relied on their primary series, which might be the reason why there's more hospitalizations. The disease hasn't seemed to have changed. These variants get more transmissible and generally more upper respiratory, more cold-like than deep flu-like. But again, if you haven't been boosted since 2021 and you've got some comorbidities, that might be enough to put you in the hospital. So that's what I have to say about boosters. I think that's a combination of the two. As far as what's out there is the BA.5. It's very colorful. This chart's gotten more colorful because there's a lot of sort of variants floating around here. There's a BF7 that's gaining traction. The BA 4.6 doesn't seem to be gaining as much traction because usually by this time it's really taken hold over the BA.5. BA.5 still seems to be outcompeting the 4.6, or they're so similar that it hasn't really gained a hold. But you do see over the last couple of weeks this BF7 has sort of taken hold, as is the dark color there. That is the BQ 1.1. See over the last couple of weeks, those two you'd watch to see if they're starting to take over. But again, they're all sort of Omicron-based, more upper respiratory, head, throat. Throat's a very common one, symptoms, sore throat. But they don't seem to replicate as well in the lungs. So not like Delta. So we just have to keep an eye on these and just go with the flow. Again, your best defense is to get a bivalent booster or vaccinated for the first time. So as a recap, the county's medium, the entire state's medium. There is plenty of vaccine and testing capability, though the bivalent vaccine, there may be, it's recommended for 5 and older. It's a recent recommendation, they dropped it to 5. There's going to be, again, more people that want it. Again, if it's something you're thinking about for the holidays, jump on VaxFinder, make yourself an appointment. You get out there and get it if you need it, if you want it, if you haven't had it. The BA.5 is still a dominant strain. There's no mandates other than the town recommendation from the select board that's been there since the spring, recommending that masks worn in town-owned properties, but no requirements. There's no mandates. There's nothing down the pipeline that says we're going to start going back to anything that we did in 2020 and 2021. So that's what I have for a recap. Again, there's plenty of COVID around. The hospitalizations have ticked up, and I think primarily because some people who have not been boosted, their vaccines are getting older, and so they may be more susceptible. And so that's what I have for an update for this week. And we'll be back on doing these every other week for a while. So that's it. Thank you. Bye.